Well, hey there. It's so good to see you. Welcome to Energy Therapy News. I'm your host, Josh Carey. Today, we're talking about healing, comfort, and calm, not just in the human, but in our four-legged friends. Our guest today is Dr. Marty Becker, known to millions as America's Veterinarian. And he spent his career helping pets live longer, calmer, and healthier lives. Today, we're going to get into all things energy therapy, and this casts a wide net. As I'm personally learning, this kind of therapy doesn't just help the human live better, but also our furry friends. Dr. Becker, so good to see you again.
Josh, I got to give you a compliment. So I always compliment you on your hair. People like me that have lousy hair are always jealous, but you said veterinarian correctly. That is a very hard word to say, and probably half of veterinarians don't even say it correctly because they'll clip off one syllable, veterinarian. But you said it perfectly.
Veterinarian.
That's perfect.
Excellent.
Perfect.
Well, thank you.
Perfect. Yes. Perfect.
Getting the title as America's Veterinarian doesn't come easy. You've been in this role for literally decades. I know that you talk greatly on the human animal bond. Frame that for us. What exactly is that?
So let's go back tens of thousands of years ago. So there was a wolf, which all dogs are derived from. We'll focus the human dog bond for a second. And that there was one, they're over there hungry. I live up in the mountains of northern Idaho where we have wolves and coyotes. There's no such thing as a corpulent coyote or a obese wolf. They wake up hungry, and every day 80% of their waking hours is spent in pursuit of food, which is far different than most, now dogs, right? So they're hungry and they're around the campfire. So there's humans cooking up some roast beast. And one of them decided, oh, hell, I'm going to go in there, and it got close enough. And I can imagine at some point in time, somebody reached down and petted it, and the human animal bond had life breathed into it. And there became this symbiotic relationship. This relationship between people and dogs is not parasitic. We don't suck everything out of them and they get nothing in return. In fact, there's something that I coined a term, the love loop, that I talked about in the book, The Healing Power of Pets. When you pet a dog, when you have close physical contact with a dog, within 90 seconds, you get a release of oxytocin. That's the hug hormone. Prolactin, think of a mother nursing a baby. Phenylethylamine, the active ingredient in chocolate. And the dog gets exactly the same biochemical spa treatment. So we decided to have this thing. First, it was around the hunt, but they became closer and closer together in this symbiotic relationship. And about 1963, about the year the Beatles invaded America, there was this migration of hundreds of thousands, millions of dogs from, in my case, where I grew up rural, barnyard to the back door to the bedroom. And Josh, I don't know if you grew up rural. If you were in the city, it went from outside in a doghouse that your dad built or grandpa built in the backyard to from outside to inside to underneath the covers. And they never left. I mean, we welcomed them. First it was always the dogs are outside, the cats are outside. Then we started to welcome them in, and that's when it really accelerated. Because to have the benefits of the healing power of pets, you have to have close physical contact. You can't pass a dog on the street. You can't look at it outside your window, running around outside, and so it's. And let me finish with this: the human-animal bond. Some people call it the affection connection. It's nebulous, but easily understood by anybody that's ever felt it. It's like describing love. And I used to have a radio show, Josh, and I'd end up by saying, there's only one greatest pet in the world. And every family has him or her. And I'm Dr. Marty Becker. And that's true. We all think we have the world's greatest pet. And that's one of the few things, matter of fact, in this deeply polarized society that we can still talk about with each other, our relationship with our pets.
Off air, I asked if energy therapy has a place in the variety of things you do. And you said, oh, yeah, of course it does. Tell me about this.
100%. So let's look at the healing power of pets. This book I wrote it with a New York Times reporter because I still remember starting to write this book. I've written 23 books, and I'd never worked with a New York Times reporter, somebody of that caliber before. And I was telling her all these things that I personally had experienced or witnessed about the healing power of pets. And she's like, Marty, we can't just say it's true. We have to prove it's true. So my brother who had MS used to talk about how when his Yorkie licked his feet, it gave him great relief from pain. My wife, who had rheumatoid arthritis, and the relief she got from this dog, from just snuggling this dog. So we went out and I think what people had always felt for years, we had intuited the healing power of pets. Science finally started to paint in the numbers of it's actually true. So, if you have a heart attack, you're 8 times more likely to be alive a year later if you have a dog. If you have a cat, you're 6 times less likely to have any cardiovascular event. That means a heart attack or a stroke. You can go along this. It's everything from relieving blood pressure to blunting depression to actually improving shortening people's recovery time for healing and sickness. So there's something there that I don't think we completely understand about this energy flow. But you hear, I wrote, was part of all these chicken soup books, and you'd hear these stories of people talking about things about how these pets knew when they were sick. It didn't matter if you had a bad hair day or a no hair day from chemotherapy. They knew exactly how to draw close. And so that human animal bond is definitely energy, 100% an energy force. And I think we too can tell when our pets, Josh, I don't know if you have pets, but you can tell when something's off with them as well. There's, I struggle sometimes to try to, I see Jane Goodall just passed on, and even these great researchers, and Temple Grandin, Fear Free's head of welfare. And so, yes, there's science behind this stuff, but I don't know. I think it's magical. Maybe we'll better understand it someday, but involved with, if I could just continue just a little bit, I'm involved with something called Fear Free, which works to relieve fear, anxiety, and stress in animals. And before Fear Free, I thought the stress that animals felt coming to the veterinary clinic was collateral damage. Why would they want to come to the veterinary clinic? They don't come by free will. They probably had a bad experience last time. We're certainly not going to abuse or purposely harm them, but let's get it done and get them back out of here. And I didn't realize the overt signs. Okay, a dog is trying to bite. A dog is trying to run away. A dog is cowering in the corner. Okay, those are overt signs of fear, anxiety, and stress. But what you start seeing is shivering. I always wondered why they shivered when it was room temperature. They're shivering because they're stressed. And that's why pets that come to the veterinary hospital, their normal temperature is 101.5. Typically in a veterinary hospital, when you take a pet's temperature, it's 103.5. And that's just from the shivering, the muscle contractions. Yawning, they're not yawning because they're bored. They're yawning because they're stressed. They're blinking, furrowed brow, pinned ears, pinned tail, that what they call the 1,000-yard stare, see the whites of their eyes, what we call whale-eyed. So they're sending all these energy signs to us that they are in extreme fear, anxiety, and stress. They think they're going to be harmed or killed, and the pet's mom and dad thinks they're hurting their pet by trying to help it. When I know my pet thinks it's going to be harmed or killed, do I really want to take it back into the same place that it survived a near-death experience? So
Mhm.
luckily now we have a better appreciation of that emotional well-being of animals along with physical well-being.
I want to get into how someone like you, in the veterinarian's role, helps and alleviates that when you notice all those signs. But first, you brought up Fear Free, which I don't want to gloss over. I know that that's an online education program. I was aware of it when we first got connected several years ago. And since then, I don't know the word, it's become massive. I mean, literally, it's blown up in an incredible way. Paint the picture. What is Fear Free?
It's unbelievable. It started out in 2010, attending a lecture by a boarded veterinary behaviorist, and her first sentence was, "Fear is the worst thing a social species can experience, and it causes permanent damage to the brain." She went on and continued that those of us in veterinary medicine are causing repeat severe psychological damage to pets by what we're doing or not doing. Behavior produces a physiologic response, so behavior is medicine. And she kept going. I was leaning in, not to borrow the term of that book, but I was leaning in, and she got to the point where she said, all animals are like a 1-year-old child. They are taken against their will for hell care, she called it. I still remember that, hell care. Number two, they have zero idea why a procedure benefits them. How would they know a skin scraping, looking in an infected ear, touching a gum that looked like a flamethrower went across it, looking at a wound, palpating an arthritic hip, giving an injection, holding them down on their back for a radiograph? How would they know that benefits them? Number three, they don't have the concept of time. I just got my COVID booster, went to the local grocery store pharmacy. I knew exactly how long it would take. I knew when they came out the little tray, the jab would take 5 seconds, and then I'm out of there. They don't have the concept of time to know fear, anxiety, and stress is going to be relieved even if it's moments away. And finally, they can't flee the threat. Okay, I just saw somebody run out of the dentist's office the other day. They were going in to have something done, and then no, they left. Okay, pets can't do that. So Fear Free is based on the work of boarded veterinary behaviorists, but it's an online education program. So there's one program for veterinary healthcare professionals. I'm happy to say, Josh, since we spoke, there's now 400,000 individuals have completed online certification for that. There's another program called fearfreeshelters.com. And for anybody listening, that's free to all shelters and rescues. It's a 5-hour online course. Almost 200,000 people have completed that. And all the veterinary technician schools in the United States that are accredited by the American Veterinary Medical Association require it. Additionally,
Require it, you said.
require it.
Wow. How do you get that designation?
Well, that's especially in education, that's very difficult.
Yeah.
But what it does, the reason it got required is so much of it is, fear free is the right thing to do because we take an oath to prevent or relieve animal pain and suffering. Number two, it's better medicine because the vital signs are more normal. The physical exam is more normal. Pets don't hide pain and sensitivity. The laboratory tests are more normal. There's a dramatic decrease, 70% decrease in injuries. So these pets aren't in fear-based aggression. So new students, Josh, I'll give you guys an example of something. When I went to school in 1980, there were 73 kids in my class at Washington State University, and there was about 80% male. Now, the new class at Washington State University is 142 students, and it's 90% female. And if we go back to 1980, probably 60 of us out of the 73 came from farmer ranch backgrounds. Now, hardly anybody comes from a farmer ranch background. So we had dealt with horses and cattle and pigs and chickens, most of us. So you saw live births, you saw deaths, you handled animals, and so that's not true today. So it's a way of teaching them how to safely handle animals and always look at physical and emotional well-being from the start. They go hand in hand like two sides of the same coin.
So the Fear Free program has touched really every aspect of the people and places that are dealing with pets and animals.
Yeah, groomers, trainers, pet sitters, boarding and daycare, emergency clinics. What do you call a veterinarian that goes house call veterinarians. There's separate programs for all of those. So what started out just to have a better visit to the veterinary practice, now everybody that touches that animal
Yeah.
looks at physical and emotional well-being. And then Fear-Free Happy Homes is complementary to all pet parents. And again, you've got to have that same kind of harmony in the home. You can't have one dog that is bullying another dog, uh, leash aggression. When you're walking dogs, all of those things. We know how to fix it, and luckily, you get the benefit. There's only 105 boarded veterinary behaviorists in North America, and it's almost impossible to get into a boarded veterinary behaviorist. But here, you kind of get the advantage of the stuff that the most common problems are already solved on there for you.
How do you and the people like you, whether fear free or in their just general practice, whatever the lane is, how do energy therapies exist? What are the applications that are most common?
So it's funny. I think it's both from the miraculous to the mundane, to high tech to low tech. So let me touch on low tech first. I know of fear-free certified practices and several of them where at 3 o'clock every day, everybody stops what they are doing and has close physical contact with a pet, typically on the floor. So everything stops. So the place stops and there's just cuddle time with a pet. I know of fear-free certified practices that people go in and read poetry to the hospitalized dogs. I know of fear-free certified practices where people go in and play music to hospitalized dogs. So I consider that all energy therapy. There are proven there's types of music that is clinically proven to reduce fear, anxiety, and stress in dogs. So there's something you can buy on Amazon called it's I Calm Dog and I Calm Cat, or through a dog's ear, through a cat's ear. It's a different. I don't know enough to describe how the music is different, but it sounds a little different to humans, but it's very pleasing to dogs and cats.
Okay.
There's separate music for farm animals that we might talk about a little bit later. Interestingly, this is always just makes people smile. Dogs and cats both love reggae, which I think is hilarious.
Proven,
Yeah,
proven.
proven that they like reggae. Uh, and then what's you would think from the time you see somebody as a child that you would want to touch a dog on the top of their head and pat down their dorsal midline along their backbone. That actually is actually a place they don't like to be touched. So, the base of the ears, side of the neck, the side of the thing, the base of the tail. So we know these. There's a really good integrative medicine specialist called Dr. Narda Robinson that used to head integrative medicine at Colorado State University. And she has a book out called Therapeutic Medical Massage. This stuff works. I mean, I've seen it work. And let's talk about, okay, that's low tech. Let's
Yeah.
talk about high tech. So we use something called class 4 laser. And this class 4 laser these are pretty amazing. So you can use lasers for treating skin wounds and wound healing and stuff, but you also use these lasers to calm a dog or calm a cat down. So we use one that just projects a line right along the dorsal midline of the pet, and you'll just literally see them like conk out. You and I talked off air about a CC loop using this. I think it's electromagnetic things. We use it a lot for pain in animals, and so you're starting to see us integrate that kind of energy therapy. There's also light therapy that I'm not that familiar to speak on, but they use pulse light therapy as well on pets. So I think we're just starting to explore where that's going to go.
This, as we're calling energy therapy, 10, 20 plus years ago, it was unheard of. What made for the shift here?
I think it took, like always happens, there's early adopters. And so it's funny in veterinary medicine, some of the people that were more open to integrative medicine were kind of like the hippie type, when they'd come to a veterinary conference. I still remember probably the top veterinary dermatologist was always in tie-dye, uh, you know, and he stood out. He had long hair, he was in tie-dye, but some people will always just like scoff at anything that's not Western medicine. And then what happens in veterinary medicine is we go on double-blinded studies, peer-reviewed studies, and you started to see the studies come in. Uh, I mean, literally, uh, even 6, 7 years ago, there were no lasers. Now every practice has lasers, and they'll have several classes of lasers that they're using. And the thing with the CC loops and other things like that are just booming. And there's clinical results, and there's lots of happy people that have had it done with their pets.
Yeah, well, I'm a happy person who we were talking about before that I recently got exposed to a product for me, and that's also used on pets and animals. And I went in with an open mind. And to this day, I'm a daily practitioner because it works. I love it. I don't know if it's playing reggae music. It's not audible to the ear, but it is a music thing that you can't hear, but your cells and your body can. Can you expand on what might be happening?
What do you use it for? Just out of curiosity. What are you
Um,
using it for?
a variety of general well-being for things like the vagus nerve, right?
Yes.
So for brain function and well-being. Thankfully, I don't personally have physical body ailments that I require it, but just for overall feel good, mental, physical, emotional well-being.
And you're asking me what I think happens. I don't really know. I wished I was probably more up on that. But, most of the time you think of the hormones. Like I have a history of depression, family history of depression. In fact, um, there's there's probably not many families have more suicides than we do. My dad's dad, brother, and sister killed himself, and my dad killed himself. And on my wife's side, her dad's brother and sister killed themselves. So there's 6 suicides, and not very many generations back. So, you know, uh, manic depression is something that's in the family.
Mm.
So it's funny how you find things. Some people find that, I know people that find that same kind of energy through prayer, that works. I know people that swear that there's music therapy that works for that. So it has to be something that is biochemical, that that you're reducing the stress hormones, the cortisol, and
Mhm.
you're increasing the oxytocin, the prolactin, the phenolphthalein, the runner's high kind of stuff. You'll see these dogs that have had, that'll be um, what we call moribund, or they're just like barely moving, and you'll do a laser therapy session on them, and they're ready to play. It's the dangest thing. So it's not just working on that limb, but it's working somehow on the whole body.
You were mentioning when we were talking about the higher tech uh, applications, um, going further than the discussion with just the dog. You said that there are other uses for the animals.
Yeah, they're using it for, I know they use it in for racehorses and stuff to calm them before races. So it's like, you can't use the Lasix and the banned substances, but there's something that's definitely just an energy therapy you're using to get a horse ready for a race.
Yeah. And then the idea of human animal bond, we're talking about emotional well-being through your fear-free education program. Hundreds of thousands of people and practices are actively using this. And to make matters even better, you're on the cusp of creating a new food category, which just
Yep.
fascinates me. I thought all foods are
Yeah.
already accounted for, but you see a new food category?
Hey, by the way, if I want to go back one step,
Please.
if you go to a fear-free practice, you can look online at fearfree.com, find one near you. If you have a dog that to get its nails trimmed thinks it's going to be killed, and which dogs hate to have their nails trimmed, and you go to a fear-free practice, and that dog after the first visit will drag you in to have its nails trimmed. And I can tell you that because where Fear Free started at North Idaho Animal Hospital. So I live in extreme northern Idaho, Josh, right up by the Canadian border. Um, the dogs in there that have their nails trimmed will drag their moms and dads in to have their nails trimmed. I see it over and over and over. So the exam room, first of all, when dogs come in, so the pet parent has to help them come in calm. So you don't get the carrier out the night before the morning of the visit if it's going to be in a carrier. It's out a week before. There's a magic carpet ride of pheromones. We tell you exactly what channel of Sirius XM, Pandora, Spotify, iTunes music to play on the way in. When you come in, you don't wait in a waiting room. You go directly into an exam room. The dog is not taken back where it probably had its nails trimmed the last time, but it's getting treats. We call it putting the treat into treatment. Every moment of the CSET, the reception treat, technician treat, veterinarian treat. There's in the place where we do the nail trims, we cook bacon every morning, so it smells like bacon. So it's the bacon room, and they're getting easy cheese, cheddar, and bacon. They're getting Braunschweiger. They're getting slices of deli turkey. They get stuff they don't get anywhere else. So, and there's not four people holding them down. It's minimal, what we call gentle control. It's minimal restraint. But to see them I was practicing last week, and twice when I got done, I went up. Typically, you check somebody out, you take them up to reception desk, and Stacy will take care of you. And I looked back to talk to them and they weren't there. And I looked back and they were trying to drag their dog out of the exam room, like they'd hooked a marlin. This is impossible. Dogs want to get out of the clinic as fast as they can, but not when you're still thinking there might be something in there to eat. So we already have programs for horses. We have a fear-free certification for equine. We have a fear-free certification for avian. But we got to looking at Temple Grandin, who's just won USA Today's Female of the Year. New documentary called An Open Door on Amazon Prime about her. But for those that don't know her, she's probably the most famous autistic person in the world, and she's rethought animal handling. So we completely rethought cattle handling, and that includes going to slaughter. But we've now involved her with Fear Free, and she's gotten to be involved on both the companion animal side, but the food animal side. And Temple and I have been talking about animals used for food or fiber. So both Temple and I love a good steak. Both Temple and I love, going to Raising Cane's, having chicken. And so, but these animals often don't have what's called a life worth living, which means they don't get to experience behaviors positive for the species. So there's something, if listeners want to look online, go to the 5 domains of animals. It came out of Europe, but the 5 domains of animals is animals have, first of all, they have space to move around. They're always in the company of their own species. So they're not, just think of a horse that's isolated by itself in a stall. That's not that's not a life worth living. It's got to have freedom to move. It's got to, and it's not just freedom of hunger. It has foodstuffs that are tasty. They are nutritious. We don't let them be too thin or overweight. And they get to experience behaviors positive for the species. So let's take a hog. Okay, if you like bacon, a hog, it needs to be able to root and it needs to be able to chew, not just sit there in a thing stall and eat. Okay, eat and sleep and shit. It's got to be able to do behaviors positive for the species. So if you look at chickens, they love to peck and graze and go out and move around. And so that's, I hear about free range chickens, but it's starting, if I could elaborate a little bit, in dairy.
Hmm.
So we've already had probably the largest Zoom call I've ever been on. We had people from Costco, Whole Foods, Kroger, the world's largest grocery store chain, the uh, the uh, the American Cattlemen's and Beef Association, the National Dairy Council, National Pork Council, the deans of several veterinary schools, and a bunch of fear-free people looking at how do you create a new food category where these animals, so it's not organic, these animals have had a life worth living. So I'll give you an example. The world's largest yogurt plant is in Twin Falls, Idaho, back where Evel Knievel tried to jump the Snake River Canyon on his cycle.
That's
Okay.
the claim to fame.
That's a claim to fame. And they now, so this is crazy. The largest dairy state is California. The second largest until recently was New York, and Idaho was third. Now Idaho's number two, but people think of New York and California, they never think those are the two largest dairy states. You think of high tech or finance or something. But down in southern Idaho, the Chobani pays a premium for happy milk from happy cows. What is a milk from a happy cow? The dairies have, and I've been to one that has 5,000 cows. Okay. There's a happy cow back scratching station per 100 cows. And if a happy cow, you can look up happy cow back scratching station. It looks like two-thirds of a car wash with no water. So the cow goes in, these rotary brushes come down, and oh man, are they happy. And then it stops. And then the next one, they're lined up like Starbucks, Josh. The next cow goes in. Then the next cow goes in. You'll see cows go back and get right back in line to go back through the happy cow back scratching station. And then when I was a kid, we had milk cows, but you milked them at 5:30 a.m. and 5:30 p.m. Well, now the cow decides, I think I'll go get milked. It goes in itself. It's mostly robotic milkers. There's facial recognition. So that Holstein cow, black and white, everyone's different. So it knows that cow. It goes in and it gets an udder massage. And the best way I could describe it for anybody that's ever gone to some tourist place and they have those saline tanks where you can float in there and then this water pounds you like this, it's very pleasurable for them. So you're cleaning they call it biosecurity. You're cleaning manure and bacteria and everything off, but it's pleasurable. They release oxytocin, more milk. Now there's pheromones. The same pheromone a mother cow secretes to calm the calf is in a synthetic version is in that barn. Now I'm going from getting my udder washed to where I'm going to get my feed and be milked. There's a sound of a mother cow calling their calf. Ah! This is pleasurable for a cow, no matter what their age is. They release more milk. So the udder massage, the pheromones, the vocalization. Now they go to their stall where there are probably 10 or 20 other cows with them getting milked at the same time. And as they're eating their sweet feed, which is warmed now, not just cold, it's warm barley molasses mix. There's a specific track of music played for that cow. There's 40 tracks of music that are clinically proven to increase milk production, and they test till they find the one that cow likes the best. So you can literally, Josh, have 20 cows listening to 20 different tracks of music while they're being milked.
Energy therapy, by the way. More
energy therapy.
This is obviously fascinating, to put it one way. And this is Chobani, did you say?
Chobani pays a premium for milk that comes from these happy dairies.
So let's think about this from the naysayer's point of view, because you have two sides of this. You have the naysayer corporations, and then you have the naysayer consumer who says, I don't care if my cow is happy or not. Why should the consumer and the corporation care about this? It's obviously a financial investment and more.
So one thing we see all the time, no BST, no BST, no BST on products, right? BST is bovine somatotrophic hormone. Yeah. So it's a synthetic way to get cows to produce more milk. So this is a way with no BST. There's a 15% increase in milk production. That's huge. That is huge, increased milk production, 15%. But moreover, what is the scourge of the dairy business, for the biggest health risk is mastitis, infection of the udder for a cow. So there's less mastitis, and the calves are born at a higher birth rate, birth weight. So the higher the birth weight on a calf, the healthier they're going to be, and there's less mortality of calves as well. So in a world where we're looking at sustainability, I think that's a good example of sustainability in a way that's um, almost seems magical, really. I mean, I grew up the only thing when I was growing up on a farm and ranch in southern Idaho, the only thing that would increase milk production depend on what you fed them. So there's first cutting and second and third cutting of hay. The third cutting of hay always was richer in protein, so the cows would produce more milk. But I don't think it's for everybody. You the demographic. I'm 71 years old. Am I the target market? No. The target market is millennials and Gen Z. They've already shown that they want to have things from where animals were they're still going to use them for food or fiber, but they're treated better. And so I think you'll find a segmented market, but increasingly I think that's why the interest from grocery is going to be I think it's going to be a dominant market.
And this is the new food category that
yet to be named, and we'll probably only play a small, Fear Free will play a big part of it, but I think it's going to, is it going to be 3 years, 5 years? I don't know, but it's 100% is going to happen. I can predict that. I've got one of the things I'm an average veterinarian, but I've had a really good crystal ball over the years, and you just read public sentiment. And I tell you what, California, Proposition 112 mandated better treatment of animals. And that passed by a 70% margin. Nothing passes by a 70% margin. So it's even being, legislated into existence. And I think it's something that the public would want. I get excited. You hear my voice rise with enthusiasm because I can just see it there. And Josh, this is crazy. I love a good steak, and you get a steak sometimes and it looks great, and then you think it's chewy as hell. I mean, it looks good. It's the same place I go all the time. What I found out through Temple, the last 5 minutes of an animal's life is so critical to meat quality. If that animal is really stressed right before it's slaughtered, it releases these catecholamines, and that's what causes the poor meat quality. And so, it's pretty, my wife just can't stand to see anything killed. I mean, like nothing. And I myself, I'm such a pacifist anymore. We have live traps for mice in our house, and this is the time of year. It was 34 degrees this morning in northern Idaho, so it's getting cold. So the mice, we have a big log house. I think they want to get in the log house. So a couple of weeks ago, we caught one, and we'd been out of town, and this mouse was in this live trap. And when I came home, it was in shock, and I actually warmed up fluids and gave it some subcutaneous fluids and a tiny drop of steroids, and put it in my coat pocket and revived this mouse and took it back outside.
What a story.
That's a true story.
I know. I believe it.
Yeah.
Everything we've discussed with the direction of the human animal bond and fear-free pets and homes, and through this new food category on the horizon, this approach, including the energy facet of it, is relatively new, but certainly integrated. Where do we see 5, 10, 20 years? What does this evolve into?
I hope that a newer generation of newer generations of people that either have companion animals or are in animals used for food or fiber understands that the emotional well-being of animals is critical. that you can't separate one from the other, and also the pain aspect. So pain is really underdiagnosed and undertreated in not just veterinary medicine, but in animal care. They can't tell you where it hurts. And so you have to be observant for where they're hurting. And one of the things that's really interesting, Josh, there's a company called Companion Vision. The founder of it graduated from Cornell with 3 degrees in 4 years, aeronautical engineering, mechanical engineering and systems integration, ended up at Google Robotics, and then went out on his own. But he's got this AI software that you can take videos of your dog, and it can tell you with better accuracy if that dog is lame than boarded orthopedist can. And also it looks for skin disease. So most animals, when they're going to have skin problems, are the number one reason people take pets to the vet. The number one thing we diagnose in a veterinary hospital is periodontal disease. But okay, what if you could catch the skin problems before they become major? So pets will always lick or scratch or bite an area before these things get started. So this software picks that up. It also is really good at body condition scoring, and it's really good at looking at the signs of fear, anxiety, and stress. Matter of fact, I saw one a story of one last week where the dog at 4 o'clock, about 4 o'clock every Thursday, started showing signs of fear, anxiety, and stress. The cameras, they had cameras inside that were showing it. What was it? It's when the trash people came and that truck was backing up. Bam, boom, bam, as they're getting these bins. That's what stressed the dog out. So I think I think AI is going to play a part in it. I think other remote diagnostics, there's a new smart pet bed out called Brisbee that takes temperature, pulse, respiration, and weighs your pet. So now, telemedicine, veterinary medicine has gotten very expensive. And I have a sister that's a Ivy League educated physician. It's a great value compared to human medicine, but it's still expensive and it's hard to get in. If we have more remote diagnostics in the home and we have a pet's weight, then telemedicine becomes really valuable. And that's how you get access to care, through telemedicine.
Dr. Marty Becker, America's veterinarian, spoken like a true professional, right? What is the message for listeners as they go about their day?
I just think for those of us that have dogs and cats, I've always said there's only one greatest dog in the world or cat in the world, and every family has that dog or cat. They give us their absolute all. We give them the time we can spare and the love we can share, and they give us their absolute all. I would just encourage people to look at both physical and emotional well-being. Now, what could that mean? Like, give 2 concrete examples. If your dog has noise phobias, like from thunderstorms, fireworks, if you're in an area where it's hunting season, like where we're at here, it's very easy to treat, to prevent. There's drugs like alprazolam, which is generic Xanax, or there's FDA-approved products like Celio, which is available from your veterinarian. That thing can clap thunder right by your house, or a firework can go off in your backyard and it won't faze your pet at all. So don't think, when they're shivering, shaking, panting, yawning, cowering, hiding in the basement, please don't let them go through that kind of distress. And also don't take them to a veterinarian where they think they're going to be harmed or killed. There's things we can do with pre-visit pharmaceuticals, or just places that know fear-free techniques, that they can be not just physically healthy, but emotionally healthy.
Absolutely amazing. drmartybecker.com and fearfree.com are the destinations. Yes.
Yeah. Thank you, Josh. You betcha. And I sure appreciate you. You do a good interview, and I like the work that you do, Josh. So thanks for bringing that to the forefront.
I appreciate that. And consider this bonus material, but certainly part of the show. As we head off the air, talk to me about the title America's Veterinarian. How, when, where, and what?
Well, I wanted to be a dairy practitioner till I got to veterinary school. And the dean gave a talk on the human-animal bond. He was a prisoner of war, a Jewish prisoner of war in Sobibor. And he was befriended by a guard dog. So the Malinois should terrify him. That's the human animal bond. He's the guy that coined the term the human animal bond, had life breathed into it in a Jewish concentration camp in Germany. He gave a talk on the human animal bond, and I had wanted to be a dairy practitioner from age 6 to when I got into school at 20. And after listening to his talk, and he asked for volunteers for the People Pet Partnership that matched elderly people with homeless pets, I went up front and signed on and decided I'm going to be a companion animal practitioner. So I was privy to the human animal bond all through school, and that led to, I don't want to tell this story, but it led to writing Chicken Soup for the Soul books. That led to getting on Good Morning America to promote the book. They didn't do so poorly that they didn't ask me back, and I was on there 17 years. Then Dr. Oz came on after me, and when he started going on Oprah, they started calling him America's Doctor. So then when he got his own show, I started even the very first week of the Dr. Oz show, and they started introducing me as America's Veterinarian. That's how it started, and it stuck.
Wonderful. I am so glad we stuck and that we're still connected. Dr. Marty Becker, thanks for everything you do.
Thank you, Josh. I appreciate it.